Diabetes and TBI. Diabetes is a complex condition, often associated with lifestyle factors and genetics. This presentation reviews that condition with some new understandings and new technology-assisted findings. The brain and spinal cord make up the central nervous system. A TBI can cause many injuries to both of those areas, and many other related structures too, that often don't get as much attention. In this video we will be reviewing some of the important concerns as they can relate to type 2 diabetes. The upper neck area, with its ligament-supported C1, C2 structures are an especially important and vulnerable area. This 3 Tesla proton density image shows the alar ligaments connecting C1 and C2. The green arrows show the strained areas from the TBI, after 3 years of healing, still hyperintense, brighter, as the collagen here is weaker, not as proton-dense, as the other segments. Compression of the C1, C2 area also involves an area known as the carotid space, which can have many vascular and neurological impacts. We will look at just compression of the vagus nerve as shown with the green arrow. Vagus nerve compression implications. To understand the connection between trauma and diabetes, we need to now focus on what happens when the vagus nerve is interfered with. The vagus nerve is important for a number of reasons. The first is that it signals to the pancreas when to release insulin. The vagus nerve controls the parasympathetic or rest and digest functions, and is one of the most important nerves in the body. We shall see why shortly. The vagus nerve also regulates the sympathetic fight or flight system and responses like cortisol and inflammation, and much more too. With a TBI, compression and rotation of the carotid sheath structures, including the vagus nerve, is often seen around C2 area. Like the wiring harness in a car, the vagus nerve has many fibers going to and from the various organs and other structures, and compression can cause many issues. As this is a new discovery, the result of better MRI imaging technology, there has been little real discussion or research on this, but this is claimed to be known. The vagus nerve regulates sympathetic responses like cortisol and inflammation and controls many important organs and systems. Insulin is needed for the cells to accept the glucose for further processing, like a key to open a lock. Without that unlocking action, the glucose stays and builds in the blood. This glucose and insulin teamwork ensures that your sugar levels stay balanced, not too high and not too low, in balance, all under the direction of the vagus nerve. But when the vagus nerve is compressed or not working properly due to trauma, it's like the messenger's voice gets faint. The messages to and from vagus nerve and the pancreas may be weak or delayed, or not happen, causing many problems. And so the wonderful harmony of glucose and insulin balance can be impaired. And an environment of overactive sympathetic nervous response of inflammation, and other issues remains, which can allow more attacks on the insulin-producing beta cells to continue as occurs with type 1 diabetes. As type 2 diabetes is very often progressive, this issue could be of interest for research. Understanding the connection between trauma to the upper cervical spine, vagus nerve function, and the pancreas could be crucial in unraveling the mystery of diabetes from TBI. Thank you for joining us on this journey of discovery. If you or a loved one are facing diabetes or upper cervical spine trauma, consult a healthcare professional for personalized guidance. As you have stayed to the end, we thank you, and if possible, could we ask you to please like, share, comment, and subscribe so the algorithm will share this information with others. Really be appreciated. Many thanks.